Welcome to our Chronic Pain Solutions video, a drug-free solution for chronic neck and low back pain, bulging and herniated discs, failed back surgery syndrome, shoulder, knee, and other extremity pain problems, fibromyalgia or whole body pain, arthritic and inflammatory joint pain. Hi, I'm Dr. Michael Taggart with the Kirkland Health Institute in Lake Washington Chiropractic. I've been in practice right here in Kirkland, Washington for over 20 years. What makes my practice unique and different is I specialize in helping people overcome chronic health conditions. And I want you to know that I have a real passion for helping people who have been to many offices and seen lots of doctors and have not received help. We get tremendous results in our office, and the reason that we do is I have advanced training in neurology, spinal rehabilitation, and also in functional medicine. Now, functional medicine is different than traditional medicine. Traditional medicine looks at primarily disease and dying tissues and treats them with drugs and surgery. Functional medicine is different as we look at the underlying mechanisms and dysfunction and causes which can cause syndromes and symptoms, and if left unchecked can develop into a disease process. So we use more sensitive testing that often finds what the traditional medical tests have missed. We also use nutritional therapies, all natural therapies like nutritional therapy, detoxification, and also neurological therapies. Any chronic condition that you have, it's very important that your nervous system, your brain, your spinal cord, and the nerves are all working properly to give you the best chance to make a recovery. There are over 900 chiropractors in the Puget Sound area, only 2 of which use full neurological and metabolic protocols to help their patients. Dr. Michael L. Johnson, a chiropractic neurologist, wrote this book a few years ago. What Do I Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine, headaches, fibromyalgia, and other chronic conditions. He developed the Neurometabolic Supergroup, which I'm a member of, and these are doctors throughout the United States which are dedicated to helping people who have chronic conditions find solutions. Dr. Johnson created a website called Life Changing Care, which is to help educate the lay public about what we're doing with the Neurometabolic Supergroup, how we can help patients. So some great videos I would encourage you to watch to talk about some of the therapies that we do. There's also 1,500 testimonials on that website. There's more added on a daily basis. Most of these patients were told by their doctors that there was nothing more that they could do. They would just have to go home and live with their condition. Thankfully, they didn't listen to their doctors. They kept searching, kept learning, like you're doing by watching this video today. And they didn't give up, and they finally found the right doctor, and they got the therapies that they needed, and it changed their whole life. So I definitely recommend you spend some time on that site. If you'd like to see some of my patient testimonials, you can go to Find a Doctor tab, and then Washington State and my name, and you can watch some of my videos. So definitely spend some time on that site. Additionally, I consult with these doctors on the board to improve their clinical outcomes. I also consult on difficult cases, so if I can accept your case in my office, you are in the 1% club. The information I'll be sharing with you, 90% of it you've probably never heard before. So I would recommend you maybe take some notes, or watch this video more than once because I'm going to be giving you a lot of information today. The practice website is kirklandhealthinstitute.com. There's a lot of other great information there as well, so spend some time with that website as well. So what's causing my pain? That's what everyone wants to know. If you have chronic pain, it means that you have massive inflammation going on in your body. Now, when you have inflammation, what that's affecting is affecting pain-sensitive structures. It's altering brain function. It's affecting your gland-to-gland communication, which is your hormonal system. It's also likely affecting your immune system. And it's also stressing your detoxification pathways. So how did I get this inflammation? You have this inflammation because you have a metabolic or a body chemistry imbalance that's promoting inflammation. And also it's likely that you also have a structural and or neurological problem that's also promoting inflammation. So let's talk about the metabolic component for a minute. Several things that can promote inflammation metabolically in the body. One big one is blood sugar. That's huge. Many people in our society are developing blood sugar problems. When you over-secrete insulin, that is inflammatory, so that promotes inflammation. Poor gut function is a big one. When you have digestive issues, that inflammation can not only be in the gut, but can also move to different parts in the joints through the blood system. It can also affect brain function. And you can develop something called leaky gut, where because of inflammation, the membranes in your intestines weaken, and then what happens is that things that shouldn't be leaking through, leak through, and as a result, it creates inflammation, your immune system activates. And that's something that can be a big issue for people who have chronic pain, and you can develop food allergies. And so as a result of result of eating certain foods, you get a new round of inflammation every time you eat them. So this is an important thing to look at. Also, when you have inflammation, it also promotes, and especially if you have digestive issues, it promotes autoimmunity. Many, but not all patients who have chronic pain have autoimmunity. So this is something that we really look into, because a lot of people who have the immune issues, it attacks the joints, and that can be a perpetuating factor of why you have pain that's been chronic. So that's something we have to look at. Now, how would we know if you have this inflammation? Well, there's different tests that we can do to determine if this is happening. We can do something called a uric acid level test. We can also do a HbA1c test, which is a means of checking your insulin levels. We can also check something called C-reactive protein, which will give us an overall level of inflammation in the entire body. We can also check homocysteine levels and also cortisol levels. We can also check your pH through saliva and urine. Your body should be mostly alkaline. Your digestive system is acid, but the rest of your body should be alkaline. So if we do these tests and it shows that your body is too acid, that's something that will promote inflammation, and also is a disease-promoting pH. So you want to be alkaline in your body. So we would do this testing via blood tests, urine tests, and saliva tests. Now let's talk about the structural issue. You may have issues with spinal nerve stress throughout your spinal column and perhaps your discs. You also may have entrapments in different areas of your extremities, like your shoulder, your elbow, your wrist, your hip, your knee, and your ankle. You may also have issues with what we call the meningeal system. A lot of people haven't heard of that system, but there is a system in their body that actually tethers your brain to your skull. It separates the hemispheres of the brain. It actually attaches to your cranial nerves, which controls all of your organ functions. It attaches tightly to your neck, loosely to the rest of the spine, and also to your low back. So if that system gets pulled or has torsion in it, it can set off pain receptors, and it can also affect organ function and also your entire nervous system. So that's something that we evaluate in our office. You also may have a myofascial pain syndrome, where you've had damage to your muscles and your muscles aren't functioning properly. We may have to do myofascial techniques to help get the muscles working better, like with trigger point therapy. That can be a very important thing for chronic pain. Now let's talk about the neurological, or the brain component of your chronic pain issue. We have a saying in our office: if you have chronic pain, we must treat your brain. Now why that's true is that a healthy brain dampens pain. So if you have chronic pain and it's not been getting better, it's likely that there's something neurologically that's going on in the brain that's perpetuating that cycle of pain. Well, how would we know if you have a brain issue? Well, we'd have to do what we call a functional neurological exam. Now, that would be different than a medical doctor neurological exam. A medical doctor, a neurologist, would be looking for tissues that are completely broken, tumors, or things that have burst, like an aneurysm. So the exam that I'll do will be different than that, because I'm looking for things that are still functioning but not to the level of health, which are creating symptoms and keeping you in pain. Once we do that evaluation, we'll be able to find what other doctors have missed, and we'll be able to do something called brain-based therapy, or sometimes called functional neurology, which will give us information, and we'll do different therapies that will help the brain balance and work better. That will help your overall health and also dampen your pain. The brain has this amazing capacity, through the principle of what we call neuroplasticity, to change quite rapidly. Just like a piece of silly putty, you can make it into different shapes. By doing different stimulations and therapies, we can get the brain to make some changes quite quickly. And you'll be amazed after we do the exam and we do some brain-based therapy about how much better you'll function just after that first visit. We'll talk more about some of these mechanisms of the neurological dysfunction, also more about brain-based therapy, and also more about the metabolic issues a little bit later in the video. There's also another therapy that we use in the office called cold laser therapy. And cold laser therapy is something where it uses wavelengths of light which penetrate the tissues of the body to promote healing. What it does is it promotes natural endorphin production, also reduces inflammation by suppressing inflammatory enzymes that create swelling and inflammation and heat. It also improves lymphatic drainage, releases tight muscles, and also helps your bones repair faster and improve cell growth. Now, in order to help you, we've got to address you neurologically and metabolic. That's so important. And we address that, we're going to help your brain, your spinal segments, your discs work better, your extremity joints. We're going to balance your body chemistry and help you, your detoxification mechanisms work better. And all of that is going to decrease that inflammation that's causing your pain. And no doctor has done that. That's what makes our office unique and different. And that's why you haven't improved.